Welcome. We're so excited to be here. Thanks so much for joining us. My name is Andrea Sampson, and I'm the founder of Talk Boutique and the Thought Leader Academy. And today I'm really excited to be here with my guest, Navin Goyal, who is a really interesting individual. I can't wait to tell you a little bit more about him. Now, today we're talking about scaling fulfillment from healthcare to entrepreneurship and beyond. And this is really the perfect topic for Navin, because you see, Navin is a physician and an entrepreneur who serves as a founding managing partner of Loud Capital. He brings his physician training to do good for people. Navin strives to make venture capital more purpose-driven, inclusive, and accessible. He's invested in over 60 companies with Loud Capital since 2015. His story, his experience, and what he sees as an opportunity for physicians have a broader impact on themselves and society. And this is the focus of his book, The Physician Underdog. Now, before co-founding Loud Capital, Navin practiced anesthesiology in a large hospital-based setting and was a medical director for a community hospital for several years. And the beginning of his entrepreneurial journey was co-founding Afore Health, a venture-backed mobile healthcare company that expands access to care across the United States with a dedicated focus on lower income and rural communities. Navin, welcome. Thank you so much for joining me here today.
Thank you so much, Andrea. It's great to be here. And that was a pretty long introduction, so I apologize if I provided that for you.
Don't even worry. You know what? I wasn't going to read it all, but you've done so many different things, from starting off as a physician to now being in the venture capital space. And I work with a lot of scientists and academics, and even people in medicine. And what I know is that many physicians do things more, sort of do other things than working in the medical world. But it's not so common to see somebody who has ventured into venture capital. I'd love to hear from you. Like, what was that process? What started you off in that area of anesthesiology and as being a physician? And today you're working in the area of venture capital. Take us through that journey, Navin.
Yeah, absolutely. And, the plan was, growing up to become a physician. It was something that was aspirational to me. And it seemed like a challenge, but the few physicians I knew in my life, in my circle of family friends, they helped people. They were very respectful with people, and they seemed fulfilled after talking with them, and they seemed very content. And that was inspiring to me. I worked really hard in school and eventually picked anesthesiology, trained for a long time to become one. And I would say when I really reflect on some of the changes that have happened to me over the years, is the getting used to learning in a consistent fashion. And so if you think about going into medical school and working really, really hard, and then training clinically in the hospitals, it was high
Mhm.
stress. It's a constant inundation of new information and applying yourself. And then what happens for most physicians is, after you pass your boards and finally land your job wherever you go to, let's say you stay in that job for a while, after a few years, your learning curve really goes more flat. And
Mhm.
for my personality and maybe the way my brain was molded as I was going through, medical school and training, was that, wait a second, why am I not learning or
Right.
reading more or doing stuff? And I think that's what really got me going into other things, because anesthesiology, being an expert in it, I don't really like the word expert very much, but I think if you know something about anesthesiology, an anesthesiologist is an expert. And there wasn't a lot more to learn outside of gaining experience.
Mm.
So I started reading at the age of 31. I started reading books. My parents told me growing up to start reading, but I was the one who said, no, that's not for me right now. So I started
Mm.
reading books in sci-fi and eventually nonfiction books, which really explored the world of entrepreneurship and aspirational companies that we know about today. And that's what really started opening my mind to people doing things, pursuing a passion or a purpose that was so large and so strong that it pulled them away from the comfort of their job or the comfort of their situation. And that started like wrangling my mind.
You know, I love that. So, first of all, just the idea of starting reading at 31. Like, I think there's something really, profound about that. Like, I mean, as a doctor, as an anesthesiologist, like, I got to believe you read a lot, but clearly it was not for pleasure, right?
Yes.
That was the thing, is that you were reading because you were learning, and the learning, though, of course, it was very formal. And so textbook reading or papers or journals, things like that. And what I find interesting is I like I mean, I've always read. I've always been a reader. But I think when I think of my own journey, I was probably in my 20s when I started reading things like science fiction and science fantasy. And it opened my mind in a whole new way. And I remember at the time thinking, oh, I don't think this stuff is for me. And yet when I started reading it, fell in love with it. And
Yes.
suddenly I saw the world differently. And so when you start, when you at 31 start like sort of delving into these new worlds and these new ways of looking at it, tell me where it took you specifically. What was the first thing that happened as you were like, well, look, I'm not learning anymore because my craft is learned and my knowledge is there, and I'm going to learn more on the job, but I'm not going to have that formal learning that I'm so used to. How did books take you into that, and where did it take you? Where was that first kind of inkling of, I wanted, maybe there's more for me?
Yeah. First of all, I remember specifically when I passed my boards and I was in the operating room with a patient, just put them off to sleep in the operating room. I'm sitting, I'm thinking, in the operating room. It was a smooth case. So I had plenty of time to reflect. And I was thinking, gosh, I have nothing to study right now. And so
Oh.
then I started having a couple conversations about this very openly. And people were like, oh, you should read this book. You should do this. And I ended up gravitating towards, okay, let me try a book. All right. Let me try a book that I get to choose, that I don't have to get tested on. And I remember one of the really, really profound series for me was Game of Thrones. I read all the books, all the
Oh,
5 books.
wow. Wow.
Yeah, and that took me into a world, and for those who like Game of Thrones, the books are just like many things compared to movies, it just goes very deep. You
Mhm.
lose yourself in that world, and it
Totally.
took me into that kind of creative world, and so what that did for me, number one, I really appreciated the writing and the stories, but it also now gave me a respect for books. Like, wow, this is why people read,
Mhm.
and I needed to
Yeah.
discover that for myself. And so
Yeah.
then I took it to, hey, let me read about people. Because I read the Wall Street Journal every day as well. Like in general, just like to be well informed. I definitely started veering towards the business section, started veering towards investments. And as I'm reading the Wall Street Journal about, back then, this is before Tesla went public and Apple was just growing, just released the iPhone. I mean, it was just exciting times, and I started reading about the biographies of these founders
Yeah.
because these were consumer products many of us knew about. So then I jumped into the entrepreneurial books, and being a practicing anesthesiologist. So, you're always a student in the medical world, it seems. And suddenly you have a job and you're an adult and you're taking care of people. So at the age of 31, I'm an adult. I consider myself an adult. But at 25, I was just training still. So it just didn't feel the same. And so, and that sounds funny to probably folks who aren't as familiar with how long this pathway is. And so now I can relate to people as they're making decisions. They're starting a company, doing this. And I'm like, I have no excuse. If I ever want to do that, I have the capabilities. I should have the confidence to do it. That's kind of what was going through my mind. So I ended up reading books about Jobs and Elon Musk and various other entrepreneurs. And I was inspired. And I
Yeah.
was inspired and interested, and then I also was, caught up financially on some things after being a poor student for so long. And then I started personally investing in some local companies. And that was like a big step for me of investing, which opened up a world of more learning and more reading.
Mm. I think what's interesting where you're taking this now, so moving from Game of Thrones, which actually I never read. I've read a
Oh,
lot of fantasy and fiction, but that one I never read. But what I love about those types of books, though, and you said it, it takes you into a new world, right? A world that is close enough to ours that it's believable, but yet far enough away that it allows our minds to open and to see different possibilities, and to start looking around at our own world and see where things are working or not working. And I think that's what's really powerful about, a good author, is that they allow us to see our own lives through the lens of these books and these worlds in a new way. And it's powerful. And then moving into biographies. Now, I am a huge fan of biographies. I've read them all pretty much. As soon as one comes out, I'm usually the first, I buy it right away. And I remember when I read the Steve Jobs biography, that
mhm.
was many, many years ago. And like you, very inspired. And where it took you was into this place of contribution. How can I get involved in these companies in a way that has me a little bit, as an entrepreneur, or has me contributing in some way to the success of something else, or and dipping my toe in. And earlier you talked about, you said, you made a comment and you said, I don't like to call myself an expert. And I get that. We talk a lot in my world about thought leaders, and we differentiate thought leaders from experts, and not as experts as a bad thing. Experts are
Yeah.
amazing. But what I think, um, where I think an expert often gets stuck is in that place of facts and data, whereas thought leaders are able to take their influence, their emotions, their connection to what it is they do, and seamlessly blend it with the facts and data that, of course, are important to underpin what they do. And so as I
Mm.
look at you, I can see how you sort of were on that thought leader journey in terms of, moving into books and understanding things at a different level, and starting to look at your own world and going, is this enough for me? I'm an expert for sure. You knew your craft, you knew, but you also were going, but there's more. And I want to, I want to influence my future in a way that is probably making the world a little bit better for not only me, but my children. And so investing in these companies allows you to start dipping your toe in. At what point did you decide to, I'm going to take the plunge and actually do it myself? Because I know you're an entrepreneur as well as being an investor. So tell us about that piece of it.
Yeah, and I think I jumped ahead a little bit because I think, and obviously life is not a timeline, right? It's like
Of
one thing
course.
happened and then one thing happened. All these things are slowly evolving. And, one of the opportunities I had in 2014 was to start a healthcare services company. Being an anesthesiologist, I co-founded it with two other anesthesiologists, and we built a company from scratch that takes an anesthesiologist and a care team to offices and puts adults or kids under sedation or fully asleep, so they can get their procedure done. And so today we take care
Wow.
of essentially kids who are on Medicaid and have a long wait at the hospital. And there's a lot of reasons for a long wait. Number one, they're on Medicaid, so it's very low priority and low reimbursement for the hospitals, so they get kicked down or down the line. And then dental in general. And I still don't understand really why medical and dental are separate, but they are. And so dental procedures are also very low priority. So what
Mm,
happens is, like, I'm in Columbus, Ohio. In Ohio, you have about a 12-month wait for a child who needs dental extractions and needs to be, taken to basically under the care of anesthesia so they can go off to sleep and the dentist can do their procedure. Instead
mm.
of waiting 12 months, we make it let probably closer to about 1 month. And we go to their
Wow.
community, we go to their office, and we do all of it there. So they don't need to travel a couple hours to a medical center if they're in certain areas. So what that did was, and that happened over time. That didn't happen day one. There was a plenty of falls, and I openly talk about the falls. Plenty of times where we wanted to give up because it was so slow and it was so hard, and there were so many questions. And then dealing with healthcare, especially in the U.S., I would just say in the world, is very difficult. You have to have
Mhm.
insurance companies, you have to have the patients, you have to have the providers, you have to have physicians. Everyone has to feel comfortable with a new model, which is not easy. Um, but what that did, that process, and so today we take care of about 10,000 kids a year in 4 different states. Very proud of what we've done. There's so many people. I'm representing just one of many people. So when I say I or we, it represents a lot of people. Um, but that empowered me, and that
Mhm.
empowered me to say, wow, by thinking about this, having this idea and moving forward on it, we've created this. And so that process, that company is growing. And then I also started investing. I was reading. So those actions now really help shape my number one, being empowered, and number two, questioning what I should be focusing on. Should I be doing more of this? Should I be taking care of a patient one on one? Which, by the way, is I'm grateful for, and physicians are grateful to do it. But in my mind, as an anesthesiologist, I was taking care of one patient briefly, let's say for a few hours, and I would never see them again. And so I
Right.
started questioning myself, am I making a dent in their journey because they were
Mm.
really sick? Am I making a dent in people's health because, I chose to be a specialist where I see them for that slice of
Right.
of
Right.
time. So all these kind of things were going through my mind, and that's some of the evolution that was going on.
Yeah, I can imagine that must be really, difficult. I mean, like you said, you're working with this patient, but I mean, you really don't know even outcomes a lot of times, I would think, right? Like you're there, you come in, you do your job, and you're kind of done. And, it's hard to connect in. And, and I mean, and your patient is unconscious the whole time. So you don't even really get to know them, you know?
Yeah, that's right. And when Offer Health started, we would get a text or a call saying, we took care of these patients today. And it was like, wow, we took care of how many patients today? While I took
Wow.
care of 3 patients today at the hospital. So I
Right.
started thinking, huh, if I were to spend a little bit more time on this world, could I scale taking care of people, taking care
Yeah.
of patients? And then the problem was so severe. You talk about a child, and
Mm.
I have 2 kids, and right now they're on private insurance. And so I started questioning, like, why am I able to take my kids within a week and these kids have to wait a year? So
Right.
entrepreneurship, the introduction to entrepreneurship for me was a for-profit way to scale a purpose and a
Mm.
problem-solving exercise. And that's how I started seeing entrepreneurship. And that shaped me. It shaped how I invest, and it shaped what, eventually started as Loud Capital.
And, that so that idea of scaling yourself, like, I think this is one of the things that most of us don't really think about a whole lot of how do I scale me or how do I scale what I do in such a way that it makes a difference in the world. I can see my difference being made in the world. I mean, the fact that you went from being a solo practitioner as an anesthesiologist to scaling those services and then focusing in on these people who were less able to access the very service that you offered. Amazing. And so now moving into this venture capital world. Now, do you only do venture capital for in the medical world, or do you go beyond that? Tell me a little bit about Loud Capital. What is it? What does it do? And how does it help? How is it continuing to scale and, as you say, make a dent in the universe?
Yeah. So when Offer Health was up and running, I was personally investing. I actually had other folks come up to me and say, Naveen, you're talking about entrepreneurship, you're talking about impact, you're talking about investing, you're not talking about anesthesiology right now. And they were curious, and they knew me. I like to talk, and I get excited about the latest thing that's in my mind. And so pretty soon they started asking questions on investments, and they said, "Hey, could I invest in some of these companies that you had just invested in?" And I said, "Absolutely. Here you go. Here's an introduction." And very soon after, it was like, "Well, I'm not that comfortable like you seem to be comfortable. You seem to be very, very interested, but I want to know if I can just give money to you and you could invest in these
Mm,
companies. And so that's where, creating a fund came from. And I have a co-founder of Loud Capital. He's a entrepreneur from the start, and exited his company, and we came together and we just really see the world similarly, and we decided to be partners in this. And so we raised a small fund in 2015, and that was the intention, was to aggregate these investors and invest in these companies like we were organically doing with our own money. But this fund slowly became more funds, and it became more of a philosophy in a firm, which was, let's continue you know um, to communicate and educate investors on the opportunities out there, and then on the investment side, invest in companies that are solving problems, that do have a really deep purpose. And how can we help these companies not only fundraise, but all the other things that come with running a company, and having some empathy and understanding from building a offer health from the ground up, and then now Loud Capital from the ground up. It's not easy, it's not a straight line, and there's so many more things outside of money that need to be done, from communication, as you do such a
mhm.
great job with, recruiting and retaining great people, continuing to be motivated on your original purpose,
Yeah.
and then when something hits you in the face, just saying, okay, how do we navigate this professionally? And so that's where the name Loud came from. There's a lot of investors out there, even very large firms, who invest capital, and then many times afterwards they kind of aren't as involved. And so we committed, to ourselves, to our investors, to our portfolio companies, to be loud and active. When you
Mm,
receive a check or an investment from Loud Capital, we have a post investment kind of platform, touch points, and ways to mitigate risk. So it makes sense for investors, but it's also really fun for us because we're very entrepreneurial. And
yeah.
that's kind of how I felt could scale these companies that are taking care. So Offer Health takes care of 10,000 kids today. That's awesome, and I co-founded that. That's wonderful. But what if I'm supporting these 60 other companies that are also taking care of people in various ways? And to
Mhm.
answer your question, it some of our earlier funds were industry agnostic, so we have different industries: technology, education, healthcare, energy. But it was pretty heavy on healthcare just because we have a pretty big network. And now we're veering towards health, back to only healthcare,
Yeah.
because there's just so much opportunity and so much, that needs to be done. And we just want to go a little bit deeper into that.
Yeah, and it's such an important area. I mean, when we talk about scaling, I mean, healthcare, our systems, I'm here in Canada, you're in the US, while we may have publicly funded health, the reality is it struggles to meet the needs of our population. I know the US, you've got your own challenges with healthcare, and the reality is there's so much that needs to be done and so much opportunity, I think, in the world of healthcare to actually really help those who are most at need, and actually to create systems. We work with, I run a program called the Thought Leader Academy, and one of my members within the Thought Leader Academy, she works within the healthcare system in the U.S., and she's got a platform right now about changing the system from the inside out. She's looking to build and create that, and I work with many different medical practitioners here in Canada in the area of regenerative medicine and system-wide repositioning of the system. And it's an area that is open with opportunity and fraught with challenges. And so the need there is really big. And the reality is we need to change. And so,
Yeah.
in your experience within Loud Capital and the work you're doing, what do you think the biggest opportunity is right now within the healthcare system? And where are, if you were to give advice to anyone out there who wants to actually make an impact in the healthcare world, where should they start?
Yeah, so I think a really large focus should be that, we spend a lot of money on healthcare, at least, in the US, and there's still so many people who don't have access to the services there. And even if they do get that service, it's insane. If they're insured, it's crazy the amount of expenses, and if they're not insured, it's crazy for self-pay and all the in between.
Mm.
So one thing I'll tell you that I didn't realize early on is when I was in my private practice, I worked at a pretty large hospital, 1,000-bed hospital, and it would be busy, it'd be full, and it year round, and we were busy. What I didn't realize is how many people weren't able to come to that
Yeah.
hospital. And what opened up my eyes was co-founding Offer Health, because then I really got a little bit closer to the communities, started to get interacting a little bit more with the families, and truly building empathy on what it was like to be on Medicaid, to be far away from the hospital system that I work for, and really saying, oh my gosh, these are folks who never even touch a primary care or eventually a hospital system. There's so many more people that aren't
Wow.
touched. So the opportunity is to provide access, but by doing that, when you have a limited resource of people who are working in healthcare, who are specialists and can take care of people, and then these large hospitals that I think is an ultra focus for a lot of medical systems, they are just one tower somewhere. It's not closer
Mhm.
to the people. So bringing healthcare services closer to the community, bringing it efficiently, economically, more inclusive care. Like there's so many things that is kind of wrong. And I don't want to be a bummer here. It's just calling all
Yeah.
problem solvers
Yeah.
to work on this. We're all patients, by the way, too.
Right.
Um, and then that's healthcare. But my kind of how I think of venture capital is, if you can take a lot of the money that's out there, that a lot of institutions, banks, corporations, private money that's going into various funds, that's going into various vehicles in private equity and venture capital, can we shape where that goes to the problem solvers that are going to successfully have sustainable solutions, not just a transaction, which is
Mm.
which is where venture capital and PE get a bad name. It's like, I'm investing in this. People do want good returns, which I respect and I want and continue to do, but it doesn't mean that the end result needs to be either a shutdown of the company, or it gets gobbled up and thrown away, or it loses its steam on the purpose. So that's where I see the bigger picture here on reshaping healthcare and reshaping a lot of other industries.
Yeah. It's really that triple bottom line, right? It's purpose, people, and planet, right? We have to
Yeah.
remember that it's not just about profit. Profit it's important. Like we
Yep.
all know this, because otherwise companies can't run. I mean, it has to in some way give back to those who are doing the work, but at the same time, it can't be at the expense of the people or our planet. So purpose and planet and profit, these are all the pieces that need to be taken care of. And so, I think, just to reiterate, what it sounds like is what you're saying is, look, if you are in the world of healthcare and are looking to start a business, look at how you can make healthcare more accessible within the communities. Make it, there's so many underserved or not served people. What can you do to actually help them? And then once you've figured that out, how can you do that at scale? Because that's where it makes a difference, and that's where truly, if you are a purpose driven individual, like I know you are, like I am, then what happens is we're scaling our fulfillment in the world, right? And that's what happens when we find those places where we can scale our knowledge and our impact. Um, Navin, this has been a really beautiful conversation. Thank you.
Thank you very much. You summarized that very well, by the way. It's like you're a thought leader and expert in communication and
Thank
storytelling.
you. Thank you. It's been really great. How can I know that you're very active here on LinkedIn? You and I met through LinkedIn and through the work that
Yeah.
we both do. So, for our listeners today, make sure you're following Navin. And if you're not following me, make sure you're following me as well. But how else can they keep in touch with you, Navin, or if they wanted to, access some of your services?
Yeah, absolutely. They can go to Loud Capital, loud.vc, for finding out kind of how I look at venture capital and how our team looks at venture capital. We have various services there. The book I wrote is on all the platforms, including Audible and Spotify. If you have a premium, they're all for free now if you're already on premium. And I'm on LinkedIn, so you can reach me there as well every day, just along with you, Andrea. I mean, we're there.
We're here every day. Absolutely. And if anyone wants to learn a little bit more about the programs that we offer at Talk Boutique and through the Thought Leader Academy, make sure to click down below. We're going to have some links into it down there for coaching through the Thought Leader Academy, which is a group coaching program. We also have individual coaching. So if you want to learn how to become an idea-centric storyteller and get your thoughts out in the world and create the impact that you want to make sure you join us. Thank you again for coming today. We are really excited by the work that you're doing, Navin, and thank you for the impact you are creating. I think we're through our time today, and check back here. We'll be doing another live probably in about 2 weeks. We'll be announcing who will be live with me then, and have a beautiful rest of your day.
Thank you very much. Thanks, everyone.
Thanks.